Let's talk about the discharge summary. It explains the surgery you had, your medical history, and what happened while you were in the hospital. It also includes information about warning signs, when to go to the emergency department, when to follow up with your family doctor, and when to follow up with the bariatric clinic. Your first appointment in the bariatric clinic will be in 4 to 6 weeks. The nutrition booklet you'll receive was created by our dietitians. It's a guide to help you follow your diet for the first 9 weeks after your surgery. The guide explains how to take your protein and vitamin supplements and why it's important to make dietary changes after your surgery. If you haven't already done so, review the vitamin example sheet inside your guide to help you buy your vitamins. You'll also receive contact information for our Nurse Navigators, a team of nurses who provide education and support to patients and families over the phone. The Discharge Nurse Navigator will contact you a few days after you've been discharged. You can call them with any questions or concerns about your recovery. Once you've got your discharge package and the nurse explains your discharge instructions, you can leave the hospital and go to the pharmacy. We encourage you to walk when leaving the hospital instead of using a wheelchair. Remember, walking is the best method to relieve gas pain. There's a lot to take in at your time of discharge from the hospital, so go back and review the last couple of videos if you think you've missed something. Of course, if you have any questions, just ask.